Hello everyone. How are you today? I hope that you are in good condition right now and also keep follow the health protocol and always apply a healthy lifestyle. Okay, for the first I want to introduce myself. My name is Indah Pratiwi. You can call me Indah. I'm from 3A class and I'm a student in English Language Education, Faculty of Language and Art, Ganesha University of Education. So first, every people in the world may know about nicotine, right? And also we know that it's not healthy or dangerous for our body. According to Wikipedia, nicotine is an alkaloid group of organic chemical compounds that are produced naturally by various kinds of plants such as Solanaceae and tobacco. Nicotine is known to increase a person's risk of developing inflammation of the lungs. In addition, nicotine can also weaken the ability of the protective tissue in the lungs to protect these vital organs. Some of the research explain that nicotine falls into the category of sedative and stimulants. Nicotine has some effects on our body if we consume it. The term nicotine's effects or nicotine's harms is usually to describe the adverse effects that occur on the body when consuming this too often. There are several effects if we consume nicotine. The first one is if we consume nicotine that can cause mouth irritation. The earliest effect of nicotine occurs are usually indicated by irritation or a burning sensation in the mouth and throat. It can also be accompanied by increased salivation, nausea, stomach upset, vomiting, and even diarrhea. So that's all for the first effect. And the second one is the dangers of nicotine on the body metabolism. Nicotine can encourage the body to release catecholamine hormones and cause a decrease in the blood glucose levels in the body. This can cause extreme hunger, trembling, palpitation, nausea, and sweating. And nicotine can also affect insulin resistance, thereby increasing the risk of developing diabetes. And the third is the dangers of nicotines are related to cancer. Nicotine is known to be one of the main cause of several types of cancer. For example, nicotine can cause pancreatic cancer by increasing the spread of tumor cancer cells from the lungs to the pancreas. Likewise, in the case of breast cancer, where nicotine can cause normal breast epithelial cells to transform and cause cancer. The fourth is nicotine can cause a heart attack. When you are exposed to nicotine, your body will experience an increase in blood pressure, heart rate, and narrowing of the arteries that carry blood. And this condition can lead to hardening of the heart wall, which in turn will lead to heart attack. And the next is the effect of nicotine on the respiratory system. The dangers of nicotine in the respiratory system can occur in two ways. The first way indirectly on the lungs when smoking or inhaling secondhand smoke. Both occur via the central nervous system mechanism. Either directly or indirectly, both can cause the first irritation of the trachea and larynx. And the second is reduced lung function and tightness due to swelling and narrowing of the lungs airway and excess mucus in the lung passages. And the third is disruption of the pulmonary cleaning system, which cause build up of toxic substance which cause irritation and damage to the lungs and increase risk of lungs infection and symptoms such as coughing and wheezing. And the last is a permanent damage to the air sacs of the lungs. The next is the effect of nicotine on immunity. The dangers of nicotine to the immune system include greater susceptibility to infections such as pneumonia or influenza. Nicotine also make disease tend to get worse and last longer in the body. And next is addictive. According to American Heart Association states that nicotine consumed from smoking tobacco is one of the most addictive substances. People who regularly consume nicotine and then suddenly stop experiencing symptoms such as craving, feeling empty, restless, depressed, moody, and irritable and others. Okay, and next, I will explain about cause of nicotine addiction. Nicotine addiction is generally caused by smoking or consuming other tobacco products, such as chewing gum that contain tobacco. Individuals who do not smoke every often may also experience nicotine addiction because of the highly addiction nature of nicotine. Every time someone smokes, nicotine will be absorbed by the blood and then flow the brain. Generally, smokes absorb 1 until 2 milligrams of nicotine from one cigarette. Once in the brain, nicotine will increase the release of dopamine, chemical that help improve mood and lead to feelings of satisfaction. Anyone who smoke or use other products that contain nicotine has the potential to become addicted. However, the following factor can increase a person's risk of developing nicotine addiction. The first one is age. The younger a person is when they start smoking, the more likely they are to become heavy smoker as an adult. And the second one is genetic. Genetic factor can influence brain receptor to respond to nicotine in high doses. The third is depression. Many studies have shown that there is a link between smoking and mental disorder, such as depression or schizophrenia. The fourth is environment. Children who grow up in a smoking environment tend to become smokers. And the last one is drug abuse. People who are addicted to the alcohol and are addicted to drugs are also more likely to smoke. Okay, next is nicotine addiction symptoms. And the following symptoms can be signs that someone is addicted to nicotine. The first is unable to quit smoking. And the second is patients are not successful even though they often try to quit smoking. And the third is keep smoking when you have disease. And next is patients continue to smoke even though they are experiencing lung or heart problems and know that smoking can worsen their disease condition. And next is avoid a smoke-free environment. And the last is avoid visiting place where smoking is not allowed, or stop hanging out with certain people who make them unable to smoke. And the last is when the amount of nicotine in the body decreases. For example, due to patient not being able to smoke because he is in a smoke room. People with nicotine addiction will usually experience some physical and mental symptoms such as anxiety, diarrhea, restless, depression, frustration, insomnia, easy to angry, and it's hard to concentrate. Okay, everyone. For the last, I want to explain about nicotine addictive prevention. The best way to prevent nicotine addiction is to avoid nicotine use in the first place and never try nicotine in any form or in any amount. Prevention of nicotine use should be done since adolescence because this age group is most susceptible to being affected to use nicotine, especially in form of cigarettes. Some of the ways below can also be done together to prevent nicotine use, which can lead to addiction. The first one is limiting access to cigarettes for minors. And the second is limiting smoking access in public space. And the third is limiting cigarette products advertisement. And the fourth is increase the price of cigarettes. Increase the price of cigarettes by increasing the tax. And the last is increase awareness of the dangers of smoking on health. Okay, everyone, that's all from me, and thank you for attention. See you for the next video.